My name is Seth Borgstede, and I will be presenting on the project I worked on as part of my capstone. So to give you a little background of how I got started with this project, in January of 2016, I was selected as the Clinton Global Initiative University Scholar for a proposal I was working on to combat diarrheal disease in rural Uganda through the use of basic cell phones. So I began working on this project through the partnership that I developed with the NGO Sozo Children, that they work really in rural Uganda right outside of the capital city of Kampala. So before beginning the project, my community partner asked me to develop a needs assessment to provide a base of knowledge for the village to really support the current programs they have, as well as future programs. So that's what I worked on over the course of the semester, is developing that proposal for that needs assessment. And the proposal was really based on the informal interviews that took place in March of 2016, and so my community partner really wanted a more formalized approach to quantify the data that they found. So the needs assessment I proposed consisted of a mixed methods approach with three main components. So I proposed developing a comprehensive survey, a focus group discussions, as well as structured interviews with the key stakeholders in the community. A huge part of the needs assessment is based on administering the assessment through the Ugandan staff. And so they'll really be the ones to collect the data and administer it. Additionally, each component will be rolled out consecutively in order to better tailor each following method of assessment. So this proposal was reviewed by Dr. Julie Prescott in the Healthcare Organization and Policy Department here at UAB before submitting to my community partner. So each component was structured in such a way to really target a few main areas that were previously noted in the informal interviews in March. So for the comprehensive survey, the main target areas I proposed were the demographics of the community, health, education, labor, and infrastructure, and with infrastructure really specifically looking at water and sanitation and technology within the community. So the focus groups that I proposed were really to assess more measurably complex data within the community. So I proposed the focus groups to be no more than 10 people and divided into culturally appropriate subgroups. And that would really be determined by the Ugandan staff. So these topics we would focus on the assessment would be health and education, those systems really at large, the common diet within the community, childbirth and kind of the practices that go along with that, and then the overall community strengths and weaknesses that they saw. So finally, we would do structured interviews with key stakeholders in the community, and this would really assess the opinions and the perspectives of major community leaders. And so these leaders were identified in the informal interviews, and they include the village leaders, the private clinic doctor, medical officers from the village health team, educational leaders, as well as other NGOs that are working in the community. So in conclusion, this was a really great opportunity for me to really practically utilize the skills I've learned in my undergrad degree program, as well as understand some of the challenges that come with developing a needs assessment and working with multiple partners. But overall, it was a really great opportunity. I'm really thankful for it. Thank you.